Next section, psychology of vulnerable. Vulnerability refers to a person's or group of persons' risk of being hurt. This can mean that the person or population exists without physical or legal safeguard that limits or prevents violation or abuse. What do you mean by vulnerable groups? Is a group defenseless? Can you define vulnerability? Vulnerability refers to the ability to withstand the effects of hostile environment, able to be easily physically, emotionally, mentally hurt, influenced or attacked. What do you think about vulnerable psychology? Psychology of vulnerable is scientific study of how vulnerable individual thought, feels and behaves are influenced by social, cultural and personal factors. Importance of study of vulnerable psychology deals with the behavior of vulnerable individuals. Psychology of vulnerable people also differ from one individual to another. Understanding the behavior of vulnerable groups is very important in nursing. These are the individuals are vulnerable for problems. The knowledge of psychology, these people will help nurses to deal with them in an effective way by extending appropriate nursing care. Types of vulnerable individuals. First, challenged. Second, woman. 3, sick. Detail about challenged. Can you define challenged? Disability or challenged as loss of function at the level of the whole person, which may include inability to communicate or to perform mobility, activities of daily living. Or necessary occasional or vocational activities. Rehabilitation is aimed at teaching patients to remediate or compensate and thus maximize functional independence. Classification of challenged. The group of children includes both A. physically challenged, B. mentally challenged. They could be broadly classified into two groups. First, motor disabilities. Second, sensory disabilities. The children with motor disabilities are orthopedically handicapped, having physical defects or deformity that causes interference with the normal functioning of the bones, joints and muscles. Second, children with sensory disability will have handicaps such as blindness, mutism, and deafness. This leads to poor development of intelligence due to lack of stimulation. Detail about physically challenged. Define physically challenged. It is a condition that makes difficult to perform some or all of basic tasks of daily life. Psychology of physically challenged. So many maladaptive reactions such as self-pity, stubbornness, shyness, refusal to use prosthetic devices, inferiority feelings, demanding extra attention, using handicap as an excuse, feeling of helplessness, jealousy, negative emotions like anxiety and depression, blame themselves or their parents. Psychological needs of physically challenged need to be counseled to accept their disability, to handle the negative emotions, getting them involved in support group, developing positive attitude towards prosthetic devices is essential. Remedial teaching or training may be necessary to overcome weaknesses. Have to be effective conflict resolution skills and social skills. Confidence building will help them overcome feeling of inferiority and shyness. Detail about B, mentally challenged. Define mentally challenged. It refers to intellectual disability, also known as general learning disability, and mental retardation, MR, is a generalized neurodevelopmental disorder characterized by significantly impaired intellectual and adaptive function. Psychology of mentally challenged. Subnormal level of intelligence, low power of thinking, unable to reasoning, low learning skill, difficult to understanding, limited interest and aptitudes, no creativity, below 70 IQ level. Psychological needs of mentally challenged. Appropriate treatment, remedial measures for the adjustment, rehabilitation, education for mentally retarded, psychological treatment, individual and group therapy. Helped in solving emotional problems, social adjustment, resolving their mental conflict through psychological measures. Parents be given training to take proper care. Special education and training. Next, we are going to deal with second, women's psychology. It is an approach to psychology that focuses on issues concerning gender, female human identity, and the issues of women face throughout their lives. Can you define women's psychology? The psychology of women or feminine psychology is a particular field of psychology that focuses on the physical, psychological, and social aspects of human females' experiences. Principles of women's psychology: women cognition, women attention, women perception, women learning, women thinking, women personality, women aptitude, women attitude, women's issues, women's developmental relational task, women's self-esteem, body image, sexuality, women's health concerns, social cultural issues for women, discrimination and disregard of female. Overwhelmed by fulfilling too many caretaking roles, college women struggling after sexual discrimination and rape, women health problems, high maternal mortality rate, high maternal morbidity rate, low life expectancy at birth, menstrual disorders, mental disorders, high suicide rate, malnutrition. Look at this, women issues. Women and psychological disorders: major depressive disorder, eating disorders and related problems, anxiety disorders, specific phobia, panic disorder. Psychological needs of women. First need, she requires her intimate words. Second, she needs behavior, interaction with others. 3, a woman needs her lovers understand. 4, she requires her effort appreciated by others. 5, she requires the husband to support her career. 6, she needs normal social life. Role of nursing to fulfill psychological needs of women by means of following services: nursing services, including maternal health nursing services, family planning services, family welfare services, medical surgical nursing services, and mental health nursing services. Three, psychology of chronically ill or sick individuals. Detail going on. Can you define chronically illness? A chronic condition is a human health condition or disease that is persistent or otherwise long lasting in its effects. The term chronic is usually applied when the course of the disease lasts for more than 3 months. Types of chronic illness: arthritis, asthma, cancer, COPD, diabetes, HIV/AIDS, cardiovascular diseases. Osteoarthritis, rheumatoid arthritis, chronic renal failure, pulmonary hypertension, deafness and hearing impairment, hypertension, diabetes mellitus, osteo. Psychology of chronically ill: anxiety, depression, despair, feeling of social isolation, lowered self-esteem, fear, abandonment, loss of control over bodily functions, affect one's manifestation of sexuality, mental status of chronically ill persons: helplessness, frustration, hopelessness, sadness, resentment, anxiety, irritability. Tension, physical, financial causes, stress, external factors, anger. Stages of the ongoing emotional process: crisis, isolation, anger, reconstruction, intermittent depression, then renewal. Psychological intervention: individual therapy, psychotherapeutic intervention, patient education, internet, expressive writing, relaxation, stress management, and exercise. Psychological issues in chronically ill: continued treatment and advanced illness, changes in patient self-concept, issue of social interaction, communication issues, the issue of non-traditional treatment. Psychological needs of people with a chronically ill: cope with the intense, sometimes debilitating emotions related to their illness, change behaviors in order to minimize the impact of their disease and maximize treatment protocol, manage the disruptions their illness may cause to their work, school, and family life. Positive coping skills: make your expectation realistic, approach problems actually, seek appropriate help, handle your anger, participate, live in the present, cherish the good times. 5 basic steps: cope with his or her challenges. 1. Establish a support network of family. 2. Surround yourself with things that inspire joy, happiness. 3. Educate yourself about your disease. 4. Take care of yourself by eating right. 5. Have a routine and do something every day. Role of nurse to fulfill psychological needs of sick individual. Identify physical symptoms. Provide necessary treatments. Support to communicate clearly. Maintain emotional balance. Maintain a positive attitude. Promote feel good about themselves. Improve their self-image. Building hope. Encourage them to get. Thank you. Have a wonderful day.